Hello everyone. Thank you for coming to this HLI webinar to talk about the Have Your Lives Fund, 6 months of impact. I am Michael Plant. I'm the founder and director of the Have Your Lives Institute, and here is the plan for today. Wait, no, too far. Okay, so I'll be talking to you about the Have Your Lives Institute, who we are and what we're trying to do, and also our recently launched Have Your Lives Fund. What's the basic idea? My colleague Ben will be telling you about the first 6 months, figures and impact, and then Ben will be turning it over to Samuel, who will mention our recommended charities and saying where the money is going, and tell you about the details there, and then what the Have Your Lives Fund enables for us, and then Alex will say some next steps to the fund, and then we'll have a question and answer session. So for the Q&A, we are doing it in the new fashion. So please put your questions in the chat throughout, and then we will compile them and ask them at the end. With apologies, we won't be asking people to present their questions verbally, as that usually ends up being a whole kerfuffle. So we'll have a couple of questions for you, and then we'll answer your questions. So please do ask those as we go through. And then we will be ending. I will be saying, well, what can you do if you want to make the world a happier place? The answer is somewhat obvious given the context, but there'll be some other suggestions. And then a hopeful task for you after the webinar is we will have a feedback survey to try and learn what you think. So that's the plan. Okay, Happy Lives Institute and the Happy Lives Fund. Who are we and what are we doing? So our slogan is taking happiness seriously. We're a non-profit research institute. We were the first organization to be doing well-being cost effectiveness research. At least we've been saying this for a number of years, and no one's claimed that we're wrong. We're also the only organization to be doing global comparisons of interventions for their happiness. So trying to find the best things globally. We started 7 years ago. Been building the field, which has now emerged around us. There are now a number of other organizations doing well-being cost effectiveness. And a couple of governments, the UK and the New Zealand treasuries, are also getting on board with all this stuff, though not necessarily because of us, although we do talk to some of them. And since we have been recommending charities in the last 3 or 4 years, we think we've influenced about just under $10 million to some extremely high impact charities. And we also do talk to academics, philanthropists and policymakers and do other bits of influence. But here we are talking about the Happier Lives Fund. But who are we? Here are our smiling faces with obligatory green backgrounds. So we're a small crack team of nerds. There's 7 of us. We're actually recruiting. We're recruiting at the moment, but this is who we are. You can see some of us on the call today. Okay, so well-being cost-effectiveness analysis. How do you quantify impact? How do we quantify impact? So apologies for those of you who might have heard this many times before, but in case you haven't, so we quantify impact in well-being life years, or well-bees. And so what is a well-be? It is a 1-point increase for one person for 1 year on a 0 to 10 scale. So if you were 6 out of 10 for happiness, and then you went up for a year, and then you went down, and you went back to 6, that would be 1 well-be. So we're using these self-reported measures of impact, quantified, to be able to compare all sorts of different kinds of things. This is the sort of solution hiding in plain sight. We think this gets at what really matters, and it's the new innovative methodology that we're trying to apply. So how do you quantify the total number of impact of well-bees for something? Well, you look at the impact per person, for how long it lasts, and the number of people. So it is quite straightforward. And so, with what confidence can we answer the question of how to turn your money into the most happiness? You might think the question of how do you do the most good with some amount of money in terms of people's happiness. Is this sort of a nonsense question? You can't possibly do it or quantify it, but that's exactly what we've been doing over a number of years. And part of the reason we have some confidence in this is we did the first ever global comparison of charities, which was published in last year's World Happiness Report, where we assess charities, as you might expect by now, in terms of well-bees per dollar. And our take-home result was that the most cost-effective charities in the world can create hundreds, even thousands of times more impact in terms of people's well-being per dollar than others. And what we're going to do is show you the highlight of the results. I'm not going to explain this in much detail, but this is the kind of spread of charity impact around the world. So what you're looking at is well-bees created per $1,000. So the longer lines means more impact per dollar. And this is all the research which has been done so far, which we've compiled, some by ourselves, some by others. And this is charities doing different things in different places, high-income countries, low-income countries. And so the kind of astonishing result as part of this, we concluded, was that the best charities in the world are about 1,000 times more impactful than the typical charity you would donate to if you picked at random in a high-income country. So that is an enormous difference, an almost unbelievable amount of difference in terms of how much impact your money can have. And it's on the basis of this global comparison that we're able to say with a little bit of confidence what the most impactful organizations are. Okay, so the Happier Lives Fund. Why did we set this up? So we set it up in about 6 months ago, no surprise, the event. And the idea is to make it as fast and convenient as possible for donors to support the best charities at improving well-being. So the reason we got going with this is that we've now been recommending charities publicly since 2022. We set up the facility to donate through our website at the end of 2024. And one thing donors kept saying to us is, hey guys, you write some really long, complicated reports. You have a few recommended charities, but it's still pretty hard to pick. Can you just do it for us? And so we thought, okay, all right, we will set up a fund, and that's now what the fund does. We almost called it a bit too far ahead. So we almost called it the No Fuss Fund, but I was voted down by my colleagues who have much more limited and adventurous senses of humor, because that was the idea. It's supposed to be trying to make things really simple. And part of the key appeals for us and potentially for you as well as the donors is that it's discretionary and it's a collective effort. So discretionary, rather than just putting out a recommendation and saying, give to this charity, we can decide where the money goes on the basis of our expertise and our insider knowledge. And sometimes we can think of more useful places to put it to have even more impact, which we think is an advantage over just providing the blanket recommendations. And there's something that I think is kind of personally really nice about it is that it's a collective effort. It's a shared pooled fund. So, I mean, I think a number of people on this call have given, you don't know each other, but this is a collective effort to try and make the biggest difference around the world. And I think that's really rather moving. That's that's part of the world that I want to be part of. And again, distinct from, okay, you kind of pick a charity by yourself and off you go. So we're sort of spinning this as the simplest way to make the biggest difference. And we are now tax deductible in the US, the UK, and also the Netherlands. If you're in other places, but you want to provide lots of money and then talk to us and see what we can work out, but that's where we are tax deductible thus far. Okay, so how does it work? So 90% of the money goes to HLI's recommended charities. We do quarterly disbursements based on our evidence and insights, and then 10% goes to power the engine, which is to support our research and operating costs, to find out what the high impact options are, to see how they're doing, and to look for new stuff. Okay, so just to recap on this before I hand it over, so donors support us and all our recommended charities with one donation. Each quarter we decide where the money goes based on what we know. Then gets dispersed on a quarterly basis, and then we tell you where it's gone. Emails to donors, blog posts, and also this call. So because this is a sort of special event where we're not just telling you here's where you could give and you give us the money and we give it to that thing, because this is where we're having to make some choices here. We particularly wanted to have this event to give you more information on what's been happening to your resources. And now I'm going to hand over to Ben.
Hi guys. I'm Ben. I'm the development manager and data analyst at the Happier Lives Institute. So what that means is it's my job to keep track of HLI's impact and find ways to increase it. So I'm going to be presenting now some numbers on what your money has done in the first 6 months of the HLF. So I had a look this morning, and as of this morning, we have raised $235,681.99 from 245 donations, which means that the mean donation is about $967. That number is, a bit skewed because we have a few very high value donations, but I think it's still really impressive that we have supporters who are giving so much on average. Uh, when we launched the HLF last year, we weren't sure how much demand there was going to be for it. But so far, we've been, I think it's fair to say, like pretty utterly blown away by the amount of support and excitement around it so far. So, where are these incredible donors who've been funding it from? We have donors across 8 different countries at the moment: Canada, the United States, the United Kingdom, France, Netherlands, Germany, Italy, and Australia, with the US and the UK being our largest supporters. We're also in talks at the moment with some of the national effective giving organizations about putting their Happier Lives Fund in their portfolio. So if you're from a country that is not the United States or United Kingdom and would like to give tax deductibly to the HLF through your country's national effective giving platform, then please let them know, let us know, because we're trying to sort of gauge demand and get it out there, and hopefully have more countries on this list. Also just quickly going to show you, this is where people have discovered us from so far. The primary driver of our attention has been the Sam Harris podcast, which Michael appeared on at the end of last year. If you haven't listened to the podcast episode so far, then we're going to include a link in our follow-up email to this event. So definitely go and check it out. I'm incredibly biased, but I think it's a really interesting philosophical discussion. So yeah, definitely go and have a listen to that. And now, for the vegan meat of it, of that $236,000 we've raised, we've sent out just over half so far, so $121,000. Uh, some of you might be wondering, why have we only sent out half so far? Well, there's 2 reasons. The first, sort of boring reason, is that Q2 of 2026 hasn't finished yet, so we've still got disbursements to go out at the end of this quarter. But the main reason is, one of the strengths of the HLF is that we can be adaptable to sort of the most current landscape of options and send money out based on what our experts think will have the highest impact. And right now, one of our top charities, Friendship Bench, is planning to launch this new project. So we've been, for the last few months, rather than sending them money at the end of each quarter, siloing it in a pot and saving it up so we can give them a big lump sum to fund this new project, because we think it's going to be an even better buy for our donors than just funding Friendship Bench's day-to-day activities. And I think Sam should be talking a little bit more about this project in his section. So of the $121,000 we've sent out so far, the split has been $60,000 to Strong Minds, $36,000 to Pure Earth for their project in Ghana, and $24,000 to Time Hacker. But much more importantly than what money has been sent out is, what has that money achieved? Well, so far it's created just under 8,000 Welbies. But we're kind of aware at HLI that we're a little bit weird in the fact that we deal with Welbies every day, and most people don't go around thinking about Welbies all the time. So what we think is more interesting for you is that when we consider that avoiding a year of depression is equivalent to creating about 1.3 Welbies. And if we take that through, then another way of saying that we have created 8,000 Welbies is saying that the HLF has helped avoid just over 6,000 years of depression. Given that we've spent about $121,000 so far to do that, that means that for every $25 that has been donated to the Happier Lives Fund, a year of depression has been avoided. And I want to repeat that because I think it is really, really, really important. For $25, the price of a meal out, you can help someone avoid a year of depression. And for those of us who've been unfortunate enough to suffer depression, or have had partners or parents or friends or children who have suffered from it, I want you to imagine being sat down by a doctor and then telling you could prevent that person in your life from suffering an entire year of depression, and the treatment costs just $25. And you know, it's quite incredible that this isn't some abstract thought experiment. This trade-off exists in the real world. The only difference is it's not your partner or your friends or your child, but someone who lives on the other side of the world. However, they are someone else's partner, parent, friend, or child. So I want to finish my section here just by quickly saying an enormous thank you to all of our donors on the call who have helped so far, and ask you to keep taking the battle to depression. There are people on the other side of the world who don't know your name, but whose lives you have changed. And I think others still whose lives you are yet to change. I cannot think of a more exciting, important, or worthwhile thing to do. So on that note, I'm going to hand over to Sam to talk more about what these amazing charities that the HLF has been funding has actually done to create these results.
Thank you very much, Ben, and please let me add my welcome and my gratitude for funding the charities that we recommend and the good work that they do. And I'm going to present these charities to you very briefly. We do two different types of recommendations at the Happier Lives Institute, and I'm going to show the 4 charities on the slide and tell you why we have 2 different tiers. First, we have top charities, which are thoroughly investigated, high cost effectiveness charities where we are very confident in our estimates. And then we have promising charities, which are potentially more cost effective, but we have less confidence in our estimate than the top charities, either because we don't have as much depth in our evaluations or because some of the data is more uncertain. Either way, all of these charities do really, really good work. And these are the types of charities that these 2 categories are the charities that we distribute money to, and I'll present all 4 of them now. The first is Strong Minds, which is one of our top charities. Strong Minds provides group interpersonal therapy for people with depression in Uganda and Zambia. In low-income settings, people can't just go out and easily find treatment for mental health problems. And so charities like Strong Minds provide a treatment that they would otherwise very rarely get access to. And one of the ways that they do this to reach more people and be more cost effective is that instead of having one expert treat a few people, they have experts train volunteers, community health workers, or teachers to then deliver the therapy in a manualized way to more people. So that reduces costs, increases cost effectiveness, and reaches more people. Strong Minds have recently passed the bar of 1 million people treated, and their costs are trending to $20 per person. So for less than a meal out, you can pay for therapy for a person in Uganda or Zambia. We first evaluated Strong Minds in 2021, in part because we expected mental health charities to be undervalued in a non-well-being approach. We know from research that health metrics tend to undervalue the badness of mental health problems like depression, and thinking of mental health just in terms of wealth seems nonsensical. So we did a review of potential charities, decided to evaluate Strong Minds, and now we are at our 4th version of our evaluation and updates in a very long and detailed 200-page report. So Strong Minds is a top charity, and it will produce 40 Wellbys for every $1,000 that you donate to them. And this is equivalent to preventing a year with depression for $32. Evaluating the charities, evaluating the charities is not the only thing that we do. We also have done a site visit of Strong Minds. We calculated value of information of funding Strong Minds' new RCT and shared that with donors and directed donors to that and funding to that. So we're very excited for that. And for all of the charities, we meet quarterly with them to get updates about their projects, about their funding gaps, about their data, about their costs. And that's how we stay informed and up to date with our evaluations. Now, we'll now show you a message from Strong Minds. Alex will play a video, and then I'll tell you about our other charities as well. Alex, I'm not getting the sound.
Happier Lives Fund on this. Congratulations to the Happier Lives Institute and the Happier Lives Fund on this incredible 6-month milestone. The relationship between Happier Lives Institute and Strong Minds has truly been transformational. What began as the external research partnership has grown into one of our most valued strategic relationships. The Happier Lives Institute's rigorous research helped demonstrate the impact of our work, introduce the Well-By framework, and change the conversation around mental health as a high-impact philanthropic investment. Through the Happier Lives Fund, Strong Minds has also been connected to a global community of supporters who would not have reached on our own. Your endorsement and commitment to effective giving have helped bring depression treatment to more people across Africa who otherwise would not have access to care. This impact extends far beyond individuals, strengthening families, improving livelihoods, and helping entire communities thrive.
Thank you very much for these kind words. And indeed, we think that we have put mental health on the map for effective giving, and that's why our other top charity is Friendship Bench, which also tackles mental health. This time, Friendship Bench provides individual problem-solving therapy for people with common mental health problems in Zimbabwe. And here as well, the therapy is delivered through community health workers, so allowing them to reduce the cost and reach more people. These are often called grandmothers. They sit on benches with patients to help them solve their problems and improve their mental health. And both Strong Minds and Friendship Bench are working on supporting governments to deliver therapy to people with their models. And Friendship Bench as well has a very low cost to treat a person at $16.5. As both these charities provide really cost-effective and effective psychotherapies. They do it slightly differently. Strong Minds as a group with more sessions. For Friendship Bench, it's individually with slightly fewer sessions, and then individuals can join support groups. And these are two really great ways of improving global well-being. We first evaluated Friendship Bench in 2023 and then updated in the same 200-page 2024 report our evaluation. Friendship Bench produces 49 Wellbees for every $1,000 that you donate, and that's the equivalent of $27 to prevent 1 year of depression. We've also done a site visit of Friendship Bench, and the project that Ben was mentioning is that we are working with Friendship Bench and partners to design a project to strengthen their monitoring and evaluating work in order for them to get more data, more information, be able to improve the good that they're doing. And that's going to be especially important when helping with governments make sure that the treatment that's delivered is high fidelity. And we couldn't do this if we were just sending donations bit by bit, but being able to accumulate the money in one lump sum is what enables us to do a project like that, which we think will lead to even more value and cost effectiveness for our donors and the people that are impacted. And I'll now read a message from Friendship Bench. As Friendship Bench works to embed mental health services within Zimbabwe's national health system, robust monitoring and evaluation systems are essential. The investment from the Happier Lives Fund will strengthen data quality, enhance decision-making, and provide the evidence needed to sustain and scale community-based mental health care while maintaining the quality and fidelity that underpin our impact. Thank you for this message from Friendship Bench. Now I'll tell you a little bit more about our promising charities. So starting with Pure Earth. Pure Earth tackle lead exposure across multiple countries in the world. Lead exposure can have really bad effects on children's development and affect their well-being for the rest of their life. And there's lead in way more products than you might imagine, not just fuel and paint, but also in spices and cosmetics. And Pure Earth goes in with their expertise and helps collect information about blood lead levels, where the products come from, and helps health ministries and governments tackle that lead exposure. The project we focused on to evaluate it, because there's different projects, we focused on Pure Earth's cosmetic project in Ghana, where Chilo eyeliner that is made in very, very large parts with lead is often applied to infant eyes, and this could affect millions of children. We decided to evaluate Pure Earth because previously we've done a cause area report on lead. So we looked at lead as a general area and found that tackling lead exposure is likely to be highly cost-effective in the wellbeing framework. And in 2024, we evaluated Pure Earth's Ghana project after discussing with them what might be the most cost-effective but not yet funded project. So we estimate that Pure Earth produces 105 well-bees for every $1,000 that you donate, which is equivalent of $12 to prevent 1 year of depression. This estimate is, of course, higher than for the top charities, but it is also more uncertain, and this is why Pure Earth is a promising charity. And we might say a bit more about this, but here I'm saying an equivalent of years of depression avoided. We're not targeting depression directly here, but we are targeting people's well-being. We're thinking of people's mental well-being, and a year of depression avoided is a useful tool to illustrate what 105 well-bees per $1,000 means. And I'll now read a message from Pure Earth. The Happier Lives Fund has been a meaningful part of Pure Earth's mission to protect children from toxic pollution. Supported by fundraising from the Happier Lives Institute, the project involves working with government agencies and local partners to assess supply chains and regulations, advance appropriate safety standards, and equip officials to monitor and enforce lead limits, and educate the public on the risks of contaminated eyeliner. Thank you, Pierre, for this message. I'll tell you now about Time Maka, which is our other promising charity, and they tackle child malnutrition in Nigeria. The treatment for child malnutrition is well known, but what Time Maka do is that they enable community health workers to deliver it directly and to the most vulnerable in their communities. So that reduces the costs and increases the cost effectiveness. They've treated almost 7,000 cases in 2025, which is linked to a cost of just below $100 to treat a child with acute malnutrition. We spent a lot of time internally exploring childhood outcomes and the link to well-being, because if you have negative shocks early in life during critical periods or sensitive periods of development, this is likely to affect a person's well-being for the rest of their life. And we think these are areas where interventions can be extremely cost-effective. And that's how we decided to evaluate Time Maka in 2024. We estimate that they produce 66 well-bees for every $1,000 donated, or an equivalent of $20 to prevent 1 year of depression. Here again, high cost effectiveness, but more uncertainty around that estimate, and that's why Time Maka is a promising charity. And I'll read a message from Time Maka. The Happier Lives Fund's support helps us improve and expand our program, treating children suffering from acute malnutrition, improving the long-term well-being of the children we serve. The Happier Lives Institute's recommendation has connected us with donors and journalists and led us to being featured in Vox. So thank you, Time Maka, and thank you all of you for funding these charities through the Happier Lives Fund. I will now tell you a little bit about what the Happier Lives Fund does for the Happier Lives Institute itself. So 10% of that fund, of the money in the fund, is allocated to the Happier Lives Institute, so us, so that we can do more of this evaluative work and find more cost-effective charities to recommend to you. At the moment, we're exploring parenting, palliative care, and violence against women and girls as areas where we might find cost-effective charities to improve global well-being, and we're hoping we'll have even more things to share with you soon. The money from the fund also allows us to continue doing our fundamental research about well-being cost effectiveness, about how we do this, how it works, how the measurement works. One example of this is recently we've been working comparing well-bees and DALYs and how well-bees are a better metric. And more generally, it also helps us continue to advise charities and evaluators on how to use well-being measures, increasing the amount of information out there about the impact on well-being that people have, and increasing in the long-term global well-being. So thank you again for funding the work of HLI and the charities that we recommend. And I will now pass on to Alex for information about the next steps for the fund. Thank you.
Thanks, Sam. Hi, everyone. I'm Alex, HLI's Chief Operating Officer, and I'm going to be telling you a little bit about the next steps for the Happier Lives Fund. So in the immediate future, we have the next round of disbursements. As you probably know by now, we raise funds each quarter, and in the following quarter, we'll disperse those funds to the charities based on the allocations we decide. So in early Q3, July most probably, we'll proceed with the disbursements of the money raised through the HLF during April, May and June. As usual, we decide how to disperse the money raised based on our existing knowledge, the evaluations that we have, and any special insights or updates that may come up. This is one of the benefits of the HLF. It's dynamic. We can be flexible in how we allocate to have the greatest impact. So we make the decisions, we communicate with the charities, of course, and then we communicate with the donors to the HLF to let them know what is happening with their funds. And with the broader public through a blog post, we share some details there. And also include it in our newsletter. So little plug for the newsletter. If you're not yet signed up, then please do go to our website and sign up there. We send about one per month, and we'll include all kinds of news like details of the HLF and further things. So this quarter, we've raised nearly $19,000, which, as you'll see here, is a bit lower than the previous 2 quarters. So this webinar is well timed. We've got a couple more days of June in case you're looking to put some money in an impactful place. But we're also not hugely surprised because there's great seasonal trends in giving, as you may well know, with a lot of donations happening at the end of the year, calendar year, or the end of the UK tax year or start of the new tax year. So we have some projected numbers here for what Q3 and Q4 could look like. Obviously, for these to happen, we need to continue the great momentum that we've already started with the HLF and keep on having a positive impact. For the whole of 2026, we're aiming to raise $500,000 for the HLF. What's probably more useful to know is that this could create nearly 30,000 well-bees and nearly 23,000 years of depression averted. So we would be really thrilled if you're happy to participate in this by either donating or spreading the word of the HLF, because it's clear that from nothing in 2025, we only started this in the 1st of December 2025, remember, a lot can be achieved in quite a short space of time. So the next steps more broadly, there's a bit of a virtuous circle here. We want the HLF to continue to grow thanks to the generosity of our donors. Our recommended charities will therefore receive more support and be able to support the people that they're reaching more on a greater scale with better quality support as things develop. And then we'll conduct further research with that 10% that Samuel mentioned. The things in the pipeline are parenting, violence against women and girls, and palliative care. There could be more things that come up as well. So the more that we receive, the more research and evaluations we're able to do, producing new recommendations, so the HLF can continue to grow in step with the donations it receives. All this taken together, we are aiming to build a happier world together. So really happy to have you here on the call with us for this. We're going to now move to some Q&A. Please do use the chat if you haven't yet to put any questions in there. There are some very keen people who submitted some questions that we'll tackle before any in the chat. But we want to first flip things and start by asking you a couple of questions. So this will be brief, but we would like you to use your phone, scan the QR code there. That will take you to this screen where you can choose, there's no wrong answers here, what appeals to you most about the HLF. So I hope you don't mind us utilizing your presence here to increase our own understanding of what works. We'll give you a couple of minutes. You can also join, I think, yes, Martina's put a link in the chat. If you prefer, you can join from your computer with the link there. It only lets you choose one option, so you will have to be decisive here. And if you are selecting other, then please do let us know what that other is using the chat function. Okay, I can see we've got 6, 7 responses. We'll let a few more come in. Neck and neck. It feels like some kind of race going on here.
God, the drama of this is so exciting. What's going to happen?
We'll give it just a couple more minutes for anyone else who wants to vote there. We can't have a 3-way tie. Or maybe we can. Well, we'll welcome any late responses there. And like I said, if you have an answer which is other, then please fill us in using the chat. So another question for you. You have heard us talk about years of depression averted in these in the presentation so far. This is something relatively new for us that we're trialing, and we're keen to get your feedback on this, because well-being is the term that we've traditionally used more. It's used more in academia, well-being life years, but we also think that years of depression averted is slightly more tangible, because well-beings are great. That's why we use them and support them, but it can be difficult sometimes to imagine what a well-being feels like. So we think that years of depression averted could be an alternative metric, and we'd like to get your hot takes, just quick feedback on whether you find years of depression averted to be more intuitive than the well-being. So we've got 9, 10 responses so far. Please keep sending them in. Well, with the votes we have so far, it's clear that more people find that years of depression averted to be more intuitive than the well-being. 11 people.
And interestingly, we have no undecideds here. We have only yeses or nos.
We're all in a very decisive mood, it seems. This is great intel for us. Do feel free to add your vote if you haven't had a chance to, because this is the kind of thing that can really shape our messaging and the conversations in the wellbeing space more broadly, ultimately to try and reach more people, have more impact and traction. Okay, so we will start with a couple of advanced questions that people shared because they were very keen to get them across and reply to our emails. Thank you very much to whoever shared these. The first is, what criteria do you use to decide which charities are included in the fund? Hopefully this has been answered in the presentation by my colleagues already. If you missed it, the charities included in the fund are our recommended charities. So we do a lot of research, very rigorous level of detail to decide which are our recommended charities. We perform due diligence on our recommended charities. So it makes sense that the charities we're willing to back in the fund are the ones that we have recommended. If you want to see more information about how we select the charities that we recommend, then please do check our website. We won't go into it in this webinar for time reasons. Another question here, are there plans to share impact data and findings from the fund with donors and researchers on a regular basis? Again, hopefully this one has been tackled earlier on. Like I think I mentioned, we put out information to HLF donors on our own website through the blogs that we do and in our newsletters. Could we be doing more? Please let us know if you think that's the case. Very happy to receive some feedback on that. And yeah, I think we'll probably move on to another question. How do you measure whether donations through the fund are achieving the intended outcomes? This is a great question, and I'm going to field this one to Samuel, please.
Yes, so to know the impact of our donations, we regularly meet with the charities and get updates on their data and their monitoring and evaluating their projects. And we regularly update our evaluations or plan to, and that's how we get more information.
Great, thanks, Sam. And there's another one here. This is the last of the pre-sent questions. What work is being done to help nonprofits translate their impact into well-being, especially in the education sector? Michael, do you want to take this one?
Yeah, I can do that one. So there's us and a couple of other organisations that are pioneering the well-being of nonprofits. Like I mentioned, the UK Treasury and the New Zealand Treasury are thinking about this in public policy terms. So there is some kind of documentation out there. We have a measuring well-being course. So if you're not already bored of looking at my face, I recorded some videos trying to work through the nuts and bolts and demystify measuring well-being. You find that on the website. We do some technical advisory for charities, but as you've seen, our small crack team of nerds is only a small crack team of nerds, and so we don't have enormous capacity to do lots of this stuff, but we do what we can. And in education, one of our honourable recommendations that springs to mind is Shamiri, which does psychological well-being work in schools in sub-Saharan Africa, I think. And so that's not exactly education, that's more like well-being in education setting. More that we could in theory do, not lots more we can do in practice here, I'm afraid.
Thanks, Michael. Thank you. I'm glad to see there are some questions in the chat. There's one about whether we've conducted research on LEAP, and I can see that Samuel's answered that. Thanks, Sam. An interesting one here from Carol, Pure Earth. What's the connection between the Welby and DALI that we're exploring? Maybe, Michael, do you want to take that one?
I can do that. Yeah, so disability adjusted life years are a mainstay of health economics and decision making. I mean, when did they first come into existence? I think it's the 1970s, maybe the 1980s. And so some of you will have heard of the Global Burden of Disease report, which tries to work out how much health is lost to different conditions. And so this is the kind of, in some sense, the forerunner of, we would like to hope the forerunner of the well-being. So the DALI is this measure of health. It's judged on people's expectations about how health states are. So it's a sort of subjective guess about the badness of health states, whereas the well-being is a measure of how people actually feel as a result of different things. So you use different bits of different data to work out how much something really affects someone's well-being versus how much do they think it might affect their lives. So we think it's a much better measure of what matters. People often ask you, what's the relationship between a DALI and a well-being? And there isn't a straight one-to-one conversion. Because it depends upon the gap between people's expectations and the reality. We are doing some, we're in discussions collaborating with some of the originators of the DALI who want to do a new Lancet Commission report on better accounting for non-fatal outcomes, NFOs, so effectively quality of life or years lived with disability for those who are familiar with this jargon. And the plan is to try and integrate well-being into that to try and work out how to do DALIs better. So what we're hoping for is that there's some sort of synthesis emerges where the usefulness of the DALIs can be integrated and synthesized with the existing from the well-beings can be integrated into the existing DALI framework with potentially really big implications for global health prioritization. So if you're keen on this sort of stuff, it's pretty exciting.
It's niche, but it's exciting. Thank you, Michael. Yeah. But if you weren't interested in this niche, then I don't think you'd be here. So I will take Liz's question, and then Sam, if you want to take Barry's. Liz, thank you. Yeah, good question. How can you manage financially travel, site visits, salaries, etc., with only 10% of donations? The short answer is we can't. So the 20% that goes to HLI from the HLF does not go as far as to cover all those things. We have funding from other sources. The 10% is only a kind of a nominal amount to HLI to maintain some research function that enables our recommendations to be made and put out to the world, but it doesn't cover the whole thing at all. So we are, of course, still looking for donations to HLI specifically. The point of the HLF was to move more money towards impactful charities that we recommend. So it's kind of two fundraising tracks where we'd try to raise some funds for HLI ourselves as a charity, and then the HLF is more focused on the charities we recommend.
And I should maybe add to that. So our recommendations are used by a number of kind of partners, of course, kind of effective giving and other bits of philanthropy. So our kind of total amount of money influenced this year is probably about $5 or $6 million. It was 2.5 last year. But this is about the HLF, which is a kind of a small but growing and very exciting fraction of what we do. And part of the reason we're so excited about it is because it's our chance to do the kind of sort of the discretionary grant making and do a bit more than just giving sort of standard off the shelf recommendations. We're really hoping to grow the Happier Lives Fund. The current room for more funding across our set of charities at the moment is $20 million a year. So basically, if someone gave us 25 million, we'd think, okay, where exactly are we going to put the next 5? And we'd really like to kind of grow the amount moved and the capacity. And we actually do expect that to be happening over the next coming years with kind of new influxes in philanthropy. And you might be wondering, hold on, if you were moving lots and lots of money, would you keep it at 10%? The answer is probably not. But part of the kind of usefulness for us, given that we need to be able to kind of do the research and outreach that makes it possible, is that the kind of the 10% is a useful kind of subsidy to that. And we would often find that our donors would want to give something to the charities and something to us. And so we thought, okay, we'll put on this 10%. And so far, no one has complained. So that's been nice.
Maybe worth just adding, donors can still donate specifically to individual charities we recommend through us, as well as the HLF, but we really think the HLF offers a more efficient, impactful vehicle. Okay, Samuel, I'm going to ask you to answer Barry's question, please. What are the bottlenecks to increasing your confidence in Time Market and Pure Earth as promising charities?
Yes, so you can find more details about the uncertainties we have in our evaluations in our reports, but for Time Market, it involves getting a little bit more data about the impact on well-being across the lifespan of individuals being treated for acute malnutrition. And also, as Time Market scales and as time goes by, we'll know more about the scale they can reach and the cost to treat they have, and that will solidify our estimates. For Pure Earth, there's more things there because it'd be really useful for us to have more information about the link between lead exposure and well-being. There's some causal estimation work that we are really hoping to do soon. We just need to unlock some data and some funding. And I know that there are more and more projects in the world of studying reduction of lead exposure. And I know there are some RCTs coming, and I hope that these RCTs will please include well-being measures. And I've already sent some information about this to some people involved. And if there's more interest in this, I'm keen to share. Also, as more projects are done by charities like Pure Earth that do projects tackling lead exposure, we'll get more information about how easy and how long and how costly it is to do, and that can reduce some uncertainty. I answered Hugh and answered the question about LEAP earlier, but do ping me in the comments if you need more information. I'll hand it back to you, Alex, and Michael for discussion about years of depression.
Thank you. Yes, so I'm not sure who the person is, but there's someone from Effective Altruism Brazil. Thanks for the discussion that's been going on in the comments here about years of depression averted. I think.
Should I say a little bit there?
Yeah, go ahead.
Yeah, so sorry, I can't remember who's the person from Effective Altruism Brazil, but you are correct. Yeah, so it's years of depression averted equivalent. So if there was some malnutrition intervention which had a well-being impact equivalent to 1/10 of a year of depression, and it happened to 10 people, we would just simply add them up and say, okay, that's a year of depression equivalent. For those of you who are grasping for an acronym, we realized in our pre-call that years of depression can be called YODAs. So we might start calling them Yodas instead. But to be determined. We decided not to ask people about whether we should call them Yodas. So yeah, hopefully that answers that one. But it's part of this theme of being able to have a better common measure of benefit that allows us to compare different things, and so we can see what really works and use evidence to find that out, rather than just guessing at what we think might work.
Thanks, Michael. Okay, we should probably move on now to what you can do. So I'll hand back over to Michael. Thank you for your questions.
Yes, thank you very much. Can we go to the next slide, Alex? Yes, okay, so Happy Lives Fund, we're excited about it. So, so thank you all for coming to this call, and thank you to those of you who have given. Thank you to those of you who are thinking about giving. And so the wonder of the fund is that it allows us to use our current expertise to really maximize the impact of money. If you're a donor, then your money, and support the most effective things that we've found so far. And we hope that this creates a virtuous circle. So by the larger the fund is, the more we can investigate things, so we can have better information on the charities, and so we can do more good together. Okay, so how you can help more concretely. So what I would like you to do is gaze off into the distance and think, who are 2 people I know who might be interested in the Happier Lives Fund? How and when am I going to tell them about this? So just wait for those faces to pop into your head. Okay, probably the first couple of names and faces are the most obvious people. So do send them a message and say, hey, I was at this thing. What do you think? If you're if you have given, then you can say, hey, actually I donated to this. I wonder if you're interested too. Doing this kind of stuff can be awkward, but I have successfully convinced some of my friends to give, and they thought, actually, this is a lovely thing to do. So you can post on social media why you gave to that, and why you gave to Happier Lives Fund, and the impact you had. So some research, which I'm not going to give a reference to here, suggests that doing this has a 12% increase. So if you gave £100, you might expect to raise a further 12. And people could often be quite shy in telling others, but actually, it's motivating, and we want to normalize giving, and particularly effective giving. So if you haven't given yet, please do consider it. If you have given, please consider giving more, and especially via a monthly donation, so that we can, because the charities operate all throughout the year, and it is better to have the kind of regular sets of income to plan around. Please do reach out to us with any ideas you have for how to make the fund grow, or make it better, or make it more exciting for you. This is 6 months into a new venture, and we're really excited about this, but we're sure we could do much better and make this much more kind of exciting and impactful than it already is. So, okay, going back to what matters, what's the impact you can have at a small cost to yourself? So we estimate that the Money to Fund prevents 1 year of depression for $25, and it really is the case that every little help, your not very much amount of money, can be life-changing to someone else, and you may never meet this person, but you will be very potentially changing their life. So now I will close on the inspiring, if slightly soppy line of let's build a happy world together, and thank you for being part of this. There's now a QR code if you want to go and donate right now, which I'm sure many of you are racing for your phones this very moment. But yes, so let me thank you for coming, and and on behalf of people who your charity will help, but who you will never meet, thank you very much.